Good day, I'm still Anna Nolte and we're still busy with the Mother Baby Friendly Initiative breastfeeding series. We're still busy with session 1. Now we are going to go to the second lesson, which is the first feeding immediately after the birth of the baby. Now in this lesson we are going to talk about the first feeding immediately after the birth of the baby and skin-to-skin contact, why it is so important. And I think it's going to be one of your biggest challenges to implement in your practice. But what I'm always saying is one understands something, why it's important, how it works, then one can always make plans on how to make it work in the best possible way. Back to the 10 steps for successful breastfeeding. This is our fourth step. Remember, we have talked now already about the first one is the policies that you in your hospital have to develop for breastfeeding. The second one was all the knowledge that you're supposed to have, and that's why you're doing all these slides. And then the third one was the preparation, antenatal preparation of the mother. And now we come to the fourth one, which says that hospital support mothers to breastfeed by encouraging skin-to-skin contact between the mother and the baby soon after birth, and to put the baby to the breast right away. And that is what we will talk about now. Now, if we just go a little bit into more detail about the steps as it's been set out by the Department of Health, and we look at the aims and the implementation standards, how you can or should implement it in your practices, I'm just going to go in a little bit more depth and detail through it. So the aim is to facilitate newborns' natural rooting reflex, and we will talk about that just much more, to initiate breastfeeding immediately after birth. And the rationale is immediate skin-to-skin contact helps to populate the newborn's microbiome and prevents hypothermia. It's also initiation of breastfeeding is typically a direct consequence of uninterrupted skin-to-skin contact, as it's a natural behavior for most babies to slowly squirm or crawl towards the breast. In addition, early initiation of breastfeeding has been proven to reduce the risk of infant mortality and morbidity. And as you will remember in the first session, we've talked about the reason for the developing of the 10 steps, and the biggest reason was to reduce infant mortality and morbidity by doing this. So the standards are to how should you implement this in your hospitals? Facilitate and encourage immediately after the birth of the baby, and we will talk about this immediateness a little bit more. And an uninterrupted skin-to-skin contact between the mother and the infant who give birth through vaginal deliveries or C-sections with local anesthesia as soon as possible after birth, within 5 minutes. Place the baby on the mother's abdomen or chest with no clothing immediately for at least 1 hour or up to 90 minutes to move through the 9 instinctive stages. Now we will talk about these 9 instinctive stages also. Now we're talking about here immediately after birth, and we're talking here about 1 hour up to 90 minutes. Now, this is to a very large extent where your challenge comes in. Now, in the case of many of you, you might already do it in your labor wards, and in other cases, you're not doing it in the labor wards. Or in some cases, you're doing it with normal deliveries in the labor ward, but not necessarily with cesarean sections after the baby has now been born. That's the one thing, the challenge to do it immediately. Now, there are some reasons why this immediateness is kind of important, but we will also talk a little bit on how you can improvise on the immediateness. The baby is usually more alert immediately after the birth of the baby, and that's one reason why the immediateness is important. Now also this lasts for 1 hour up to 90 minutes, and you will see on the video it's quite a slow process. One should not be in a hurry. One should not be impatient. We should allow the baby to do his own crawling and his own going through his 9 stages, as you will see on the video and as we go through this lesson. On the other hand, we also know that the first hour after the birth of the baby is a very important hour, physically wise, in the sense that it's high risk time for the development of postpartum hemorrhages and other complications like preeclampsia, eclampsia, etc. So we can't leave the baby to the mother for an hour and just do our own thing. Obviously, we will be still busy for a part of this hour, delivering the placenta, suturing an episiotomy if there is an episiotomy, etc. But normally, it takes quite a while, as I'm saying, and one needs to be patient. So again, as I'm saying, that's one of your biggest challenges as far as the 10 steps of baby-friendly hospitals are concerned. But again, as I'm saying, if one understands the importance of this, then one can always make sure how you can implement it in the best way in your specific unit. Now, what we usually do is we get the baby born, we fix the mother, get the placenta out, episiotomy, and then we weigh and measure and bath the baby, etc. But here we say the weighing and the measuring and the bathing of the baby and cuddles by others are delayed until the infant has moved through all these stages. And then he can be cuddled by the other people, and then we can start doing all the other procedures. So that's important. And support the mother to initiate the breastfeeding. The mothers, as we've said in the third step where we talked about antenatal preparation, this is one of the things that the mother should be prepared for during antenatal period, so that when the baby is being born, she should be motivated to do this as soon as possible, and she should be supported and helped to do it as well. Facilitate and encourage the mothers who gave birth through C-section with general anesthesia to produce skin-to-skin contact as soon as the mother is sufficiently alert to hold the baby. And then in the postnatal period, these babies can be given to the mother skin-to-skin contact, and the baby can go through all these steps, even though it is a little bit later than immediately and within 5 minutes. But it's still better than not at all. And in the meanwhile, the baby should preferably be nursed next to his mother until she's awake, and not in a separate nursery. Now again, there are certain adaptations that you need to make in your wards and in your postnatal period to accommodate this. Now, mothers of infants who are medically unstable following delivery may need a delay. That's like in, for example, mothers who had postnatal labor complications or had lots of anesthesia, for example, or premature infants or sick infants or infants who needed resuscitation. Again, this may delay the initiation of the first breastfeeding, but it should also be done as soon as possible. Now, in the case where immediate skin-to-skin care and breastfeeding is not possible, the infant should be provided with some things with maternal scent on it. For example, a breast pad or expressed breast milk on a cotton swab, a mother's milk or mother's clothes or something like that, so that he has his mother's smell quite close to it. Now, the previous page was on normal deliveries. This is more or less on cesarean sections. The optimum practice is to put the baby also on the theatre table immediately after the birth, within 5 minutes, also skin-to-skin contact. Now, this might also be a little bit different, and I will show you a photo just now where and you will also see on the videos the baby has been put on his mother's abdomen in a prone abdomen to abdomen, his abdomen to his mother's abdomen kind of position. Now, obviously, with a cesarean section, he wouldn't be able to lie on his mother's abdomen because that's covered in cloths, etc. So we have to make already here a little bit of adaptations, and to put the baby rather on the mother's chest. Um, and he should be going with his mother, staying in the theatre till, if possible, for this latching to take place, and then he should be transported to the postnatal ward on his mother's chest. Now, if this is not possible, because if you work, for example, in a very busy labor ward where there's quite a few C-sections being booked, one after the other, one again have to improvise on this and make this happen in your recovery room, or have the mother skin-to-skin contact at least, and then move her to the postnatal ward, and hopefully the whole breastfeeding part can take place in the postnatal part. Now, the minimum requirements after cesarean section, that if the mother is not having a general anesthetic, a baby has been put on her chest for skin-to-skin contact in the theatre and continues in recovery, and unless evidence can be provided that the mother or the baby's condition prevented this, again, if the mother had some or other complications, or the baby is sick, or the baby has been resuscitated. We have talked about when the mother had general anesthetic, that as soon as she can, should have skin-to-skin contact with the baby as soon as she's able to respond to her baby. Now, mothers who are not able to initiate breastfeeding during the first hour after birth should be supported to practice skin-to-skin contact at least, and then to breastfeed as soon as they are able to do that. So again, if you're not able to do it in your very busy theatre, at least get the baby skin-to-skin contact on his mother, and then in the recovery room or in the postnatal ward, then the breastfeeding can happen, or the baby can do his crawling and his developing, going through the stages. And again, in the meanwhile, the baby can be provided with his maternal scent. Now, observe and assess and manage for any signs of distress, including the mothers. So that's why I'm saying we can't leave the mothers alone. We still need to do our observations and our assessments of the patient as normal. A healthcare worker or a doula or a friend or a family member should support and accompany the mother where feasible. And I would say a healthcare worker should have a very close kind of supervision over the mother and this whole process. You can't just leave the baby and the mother with a friend or a family member or a husband. Now, if a baby is cold from the birth process, instead of putting the baby in an incubator, skin-to-skin contact will help to rapidly increase the baby's body temperature, so it will cause rapid heating and thermocontrol. Now, when we look at the standard for mothers of preterm babies, now obviously preterm babies are not able to suck. They say here that babies may not be able to root or to attach the breast and suckle, or they might be from 27 weeks of gestation. Now, this is a very individual thing. It differs from baby to baby. As we've seen earlier, the sucking reflex only gets established around 32 to 36 weeks of pregnancy. So if the baby is stable, the preterm infants can start with direct breastfeeding if he can. But it might be difficult for the babies, and again, there's not lots of milk. So early and frequent milk expression within 1 to 2 hours following the birth is critical. And the reason why it's critical is, as we will see and we'll talk a lot, it's essential that the baby's first feed should be colostrum, and that he should get it as soon as possible after birth to prevent other complications like, for example, hypoglycemia. So the baby should get some expressed milk as soon as possible, and get it through a syringe or in whatever way. And in the meanwhile, you should get the scent or the whatever breast pad or cuddle blanket from his mother. Now, we have seen, and I think many of you are aware of also all the advantages of skin-to-skin contact in general and so-called kangaroo care as far as premature babies are being concerned. So I'm not going to talk in too much depth and detail about that. Now, if the mother is not planning to initiate breastfeeding, if she has decided that she's going to bottle feed, the same procedure can still be done. The baby can still be put skin to skin contact on the mother's abdomen, which is very good for the baby as such, because it prevents hypothermia, and it also increases the bond between the baby and the mother. So even non-breastfeeding mothers can still experience skin-to-skin contact with their babies. Now, the minimum requirements when an audit is being done in your hospitals to see whether you meet the baby-friendly requirements, at least 80% of mothers of term infants report that their babies were placed in skin-to-skin contact with them immediately or within 5 minutes after the birth for at least an hour or more, unless there was a medical reason for it. Or at least 80% of mothers of term infants report that their babies were put to the breast within 1 hour after the birth, unless there were documented medical justifiable reasons. And at least 80% of mothers with preterm or sick infants report that they have been helped to express milk within 1 to 2 hours after the birth of the baby. Now, if we look at the advantages of this early first breastfeeding, why is it so important? Then we see that oxytocin has been associated with positive maternal feelings. It's the feeling good hormone, and it's also been associated with maternal bonding. Now, this is then very important to optimize the mother-infant interaction as soon as possible after birth. Now, what is very important here is that after the birth of during labor, the oxytocin levels of the mother is quite high, because we know that oxytocin is responsible for all the contractions. And then also, after the birth of the placenta, oxytocin is responsible to retract and contract the uterus to prevent bleeding. So there are high levels of oxytocin in the mother present around this birth process, and this helps to optimize this mother-infant bonding. So this is very important, and this is also one of the reasons why as early as possible after the birth of the baby. Now, also skin-to-skin contact. The skin-to-skin contact is very important also, because it stimulates bonding, and it stimulates the bonding centers of the brain, and it's usually the emotional centers in the brain that the centers that is been involved in emotional feelings, and that also improve confidence and decrease depression, specifically postpartum depression afterwards. There's evidence that has proven that this is true. It helps the uterus to contract, and it decreases bleeding, and it also increases the milk supply, because we have said often in the beginning that the sooner the baby starts drinking, the more of these prolactin receptors are being formed that's responsible for more milk production. So already we start with the increased milk supply as immediately or as soon as after birth. Now, the advantages for the baby. In a Cochrane review, now for those of you not knowing what Cochrane reviews are being done to provide us with evidence on what can work in our practices or not. So in a Cochrane review, they will review all the research that has been done on a specific topic. So for instance, in this case, the Cochrane review was done on all trials, on 38 research trials regarding this early breastfeeding. And then to see what the results of all these trials were and what the evidence tells us, if it's worth the while to do it or whether it's not worth the while to do it. Now, in this Cochrane review, 38 trials with 3,472 mothers have been used in different countries also. So this is really a very wide review that has been done. And that has shown that early skin-to-skin contact for healthy newborns resulted in lower infant crying time. That's specifically now after the birth of the baby. It improved thermoregulation, because the mother's body heat is transmitted to the infant. It lowers the heart rate of the baby. It lowered the rate of the hypoglycemia, and this is specifically, obviously, from the early breastfeeding. It improved the total duration and exclusivity of breastfeeding. We have talked about this in the first session already. Mothers who are doing early breastfeeding, who are doing this early breastfeeding, most of them are still breastfeeding when they are going home after discharge from hospital, and most of them are exclusively breastfeeding for at least 6 months after the birth of the baby. And for preterm and low birth weight or sick infants, this might be even more pronounced, because we have said that there's a lot of skin-to-skin advantages of skin-to-skin and kangaroo care in all these specific babies. It helps to also not only improve the physiological aspects of the baby, but it also improves neurosensory development of these babies. And then more advantages for the baby, and here it goes basically about the early advantages of colostrum, and we have talked about that now many times. We have said that colostrum contains all the antibodies and anti-infective proteins that the baby needs, and this protects him from infections. So the colostrum, as we've said, contains much more protein than mature milk, and these antibodies and the anti-infective aspects are in these proteins to prevent the baby. We have also said that colostrum has a purgative effect, but that there are also some enzymes in the colostrum that helps with the development of the gut of the baby to digest better, and it also helps to clear the baby's gut from meconium. And we've also said that it helps because it clears the bilirubin from the gut. It also helps to prevent jaundice from becoming severe. Now, if artificial feeds have been given before a baby has been given colostrum, there's a higher, it's likely to cause allergies and infection. And the reason why the allergies and infection are more possible then is because the infant didn't get these antibodies and infective proteins to protect him against the allergy and the infection. And as we've said so many times, I'm always saying it, that if a mother can give the baby the advantages of colostrum and nothing else, she has already gained a lot. Now, the advantages of this early breastfeeding for breastfeeding as such is it has been demonstrated, this process has been demonstrated to approximately double the maternal self-efficacy with breastfeeding. It makes mothers much more confident. It makes them to work. It's easier for them to get everything to work. So in total, as we've said also previously, the success rate of breastfeeding is just much higher when it's been done quickly. Now, the length of the skin-to-skin contact is also directly related to breastfeeding exclusivity on discharge from the maternity care. It just makes it all goes with the thing that mothers are just much more successful in breastfeeding. So it's easier for them to exclusively breastfeed instead of breastfeeding with supplementary feeds, etc. And as we've said now, a baby having more than 1 hour of skin-to-skin contact is more than 3 times as likely to be breastfeeding exclusively on discharge. Now, in the rationale and implementation standards of this fourth step, we have talked about the 9 instinctive stages of the newborn. Now, a certain Anne-Marie Wittstrom, a Swedish researcher, has done some research on it, and I will also attach the article for you. There are 2 articles that's very interesting to read. So if you have time to read it, please do so. Now, also again, this research has been done a while ago, but it's still being used, and you can clearly see it for those of you who have done skin-to-skin contact and early breastfeeding to babies. I'm sure you have seen the baby going through all these stages. If you haven't done it before, you will see on the video that I'm showing you, you can clearly see these different stages. Now stage 4, and I'm going through the stages quite superficially and briefly. If you read the articles, you will see specifically the one article gives a lot of advice on how the baby goes through it and how you can motivate and encourage the baby to go through these different stages. Now, first of all, the first stage is now the baby has been born, and we all know about this distinctive cry immediately after birth when the baby expands its lungs. And then after that, immediately after this birth cry, there's a stage 2 where the baby has been much more relaxed. The baby is now being placed skin to with his mother, and he starts to relax. His hands are open and relaxed. He takes a deep breath and then just be very happy that he's on his mother's skin and in this world. Then we get a awakening stage, that's stage 4. The baby starts now to move, make small movements with his hands and his shoulders, and this occurs about 3 minutes after birth. And this is the area or the time that the baby, this awakening phase is very important for this first breastfeeding baby. Now, just before we carry on, we have said many times there are individual differences. There are individual differences between mothers. There are individual differences between babies. So this is a more or less average kind of way that the babies react. And when we are talking about this first infant feeding or first breastfeeding, I'm talking in this specific lecture about a perfect term, happy, awake baby, awoke baby. Now, this, I'm not talking about preterm babies. I'm not talking about mothers who had lots of analgesia. I'm not talking about babies who have are sleeping. I'm not talking about babies who had resuscitation. I'm talking about the perfect baby. So, and in the perfect baby, there's this awakening phase immediately after birth, and this lasts for about an hour. And you will see when the baby come at the end of these 9 phases, he goes into a relaxed and sleeping phase again. Then it's gone. Then it's away. So and that's why it's so important for us to really make use of this first hour after birth. Now, if we look at this further at this stage, we call it stage 4, the activity phase. There are now more activities. The baby starts now making mouthing and sucking movements as he starts exploring his own environment with his mouth. And this you can also clearly see on this on the video. He has his more stable eye movements, and he starts looking now specifically at things, and he starts looking at the breast, and he starts looking at the mother. And this is, remember, when we talked about the areola, this is where the dark pigmentation of the areola comes in. It attracts him. It stands out from the breast. It's something that he can focus him on, and that attracts him to the nipple area of the breast. And you can also see this clearly on the video. He starts now to move his hands to his mouth. Some of them sticks their tongue out and massages the breast with 1 or 2 hands. Some of them put their fingers in their mouths and they start doing sucking movements, sucking sounds with their hands and their fingers. So there's a lot of activity here. Now all these movements also now increase the release of oxytocin in the mother's body. This baby lying on his mother's tummy, seeing all these, feeling this positive feelings about the baby, increases the release of more oxytocin. And this also increases the bonding, and the oxytocin is necessary for the lay down reflex. So all in all, this becomes a very positive cycle for both the mother and the baby. Then stage 5, and these stage 5s and 4s are going backwards and forwards. The baby have periods of rests in between these activities. So he rests and then he starts again, and then he rests and then he starts again. And what's very important, and that you will see also this very clearly on the video, it's not that the baby is not interested in the breast. And it's not that the baby is going to sleep now and is not going to breastfeed. It's just part of this whole movement. It's just taking a little bit of a rest period before he continues. So it does not mean that we should rush him and start helping to latch him. Don't interfere. Just leave him alone. Then we get the stage that we call crawling, and the baby literally crawls. He uses sliding, pushing, leaping, crawling movements to the breast. And you will also see this clearly on the video. These are short periods of action around about 35 minutes after the birth of the baby. He starts almost pushing himself upwards in the direction of the breast. Stage 5, he familiarizes himself now with the breast. He gets acquainted with the nipple by licking the nipple and touching and massaging the breasts. And this begins more or less also 45 minutes after birth and can last 20 minutes. But again, there are many individual differences. Many individual babies differ in how quickly they go to this phase. He makes sounds that gets his mother's attention. He looks at the other people. He looks at her. He looks at his environment. He can start focusing now. And he starts moving in a purposeful manner. And again, it should be peaceful and not unhurried. You should not try to latch the baby or interfere with this whole process. Let him do his own thing. At this stage, his tongue is still flat and high on the roof of his mouth, so he is not ready to really latch the tongue. He needs to cup the tongue around the nipple when he really needs to latch, as we've said previously. And then when we get to stage 8, the baby takes the nipple, he self-attached, and he suckles. And this again depends on whether the mother had analgesia or anesthesia, and it might take a little bit longer for a baby to complete these stages because he will be more sleepy. And then final stage is both this baby and the mother will fall into a restful sleep together. Now, the rest periods which are interspersed are particularly important as the baby is assimilating the information gathered from the journey that is in undertaking. And that is why it's so important that we should not interfere with these rest periods and getting impatient. Now, as we said, this is not always easy, specifically if you work in a very busy labor ward, or if you work in a theatre where a row of mothers are waiting for their cesarean sections to happen. It's difficult to be patient for a baby to explore the breast for an hour long. But unfortunately, a lot depends on it. The success of breastfeeding depends on it. So we have to make provision in our labor wards for this. And again, if you see how important this is, I'm sure you will make the necessary arrangements to be able to allow this. Now, just a little bit more about the crawl that the baby, when he's putting on for his first breastfeeding, he should be prone on the mother. It's a tummy to tummy, and this might be the one place where it's a little bit difficult with cesarean section mothers, where it might be a little bit better to wait till the in the recovery room or in the postnatal period, instead of when all the cloths and things are still on the mother in the theatre. In the theatre, the baby can be placed skin to skin on the mother's breast, but then on tummy to tummy later on to allow for this crawling to be taken place. Now the baby should be dried, because now the baby comes out, is wet, is immediately from the vagina up to on the mother's tummy. The baby should then be dried to prevent him from cooling down, but under no circumstances should his hands be dry, because his hands are full of amniotic fluid, and that's the same scent that is in the breast milk. So his hand should be kept wet, but his body should be dried, and then dry blanket should replace the wet one. So we dry the baby and cover him with a dry blanket. Now, the odor of the breast, the maternal heat, and heartbeat. He has heard his mother's heartbeat all the time, and the vernix all combine to help the infant orientate to the breast because it all has the same smell. So it helps the baby to move into the direction of the where the smell is now coming from. And in this position, the infant's legs are be able to massage the uterus. Also, the infant pushes himself upwards towards the breast. And this also massages the uterus a little bit and obviously prevent postpartum hemorrhage, because as we've said, more oxytocin is being secreted, and this is also massaging the uterus. And then after crawling, a few rest breaks, massaging the breast, licking the nipple, then he will eventually grasp the nipple and start with his first breastfeeding. Now there are different things that helps the baby to crawl towards the breast, that makes him get going in the correct direction, if we can call it like that. First of all is smell. We have talked now about the smell of the amniotic fluid and the vernix and the etc. It's all the same smell from his mother, and that's the smell that attracts the newborn and will draw him to the breast milk. Sight, we have seen that he's looking at, he can look, start focusing, and he prefer high contrast images, where there's a big difference between the background and the foreground, so that he can see easily. And that's where we've talked about the areola, and the darker areola comes in. Also, he focuses on his parents' faces and specifically eyes, because that's also something brighter and darker that stands out. Amniotic fluid taste. The amniotic fluid tastes apparently more or less the same as the maternal milk. So it's familiar flavors that he has. He has known the taste of amniotic fluid all the time, and now he's calling to get the breast milk that might taste the same. He heard his parents' voice, his mother's voice all the time. And it's very important also to tell the mother and to encourage the mother to talk to the baby now when he's crawling on up to the breast, because he knows that voice and he's reacting towards it in a positive way. And then touch, skin to skin contact, again helps the baby regulate his body temperature. It keeps him warm. And then the first colostrum will also help to regulate his sugar levels. And there's less crying, and it facilitates bonding, we have said often now. Now, potential obstacles to this first latch, we have talked about that often now already. We talked about the heavy medicated mother, analgesia, pethidine, other medications, a cesarean section where the mother had general anesthesia, a sick infant where the baby has respiratory distress or low APGAR scores and been resuscitated, prematurity, etc., and a normal, just stable premature or late premature infant. Now, we also have talked about the different procedures that's been done on the baby, and that should be postponed till after the baby has had his first breastfeeding. So also again with research that has been done and other Cochrane reviews that has been done, it was suggested that the standard of care, in other words, the best practice of care, is to move the bathing to a later stage and to do immersion styles of baths, meaning that the baby has been put into a bath instead of just a sponge bath where the baby has been just sponged down. There are lots of cultural and other traditional variations on first baths and skincare, which one should give attention to and talk to the mother again about this. But as we've said, the big issue is, our big main aim is to decrease the mortality rates. And specifically, if we focus here on decreasing the mortality rate because of keeping the baby warm, and also when he's cold, he uses a lot of his glucose to produce heat. So obviously will also help him to stay within with a normal blood glucose level. Now, when we've gone through all the implementation standards, we've also talked about what to do when the skin-to-skin contact cannot happen. And we have said that in what's most important here is when the first breastfeeding can't happen, is to express the breast, the colostrum, so that the baby can have all the advantages of colostrum still, in if he can't do the proper sucking of it, and it can be given to him then in a syringe or a cup or a swab. And then as soon as the mother is awake and alert, and or as soon as the baby is then in a better condition, this breastfeeding should be tried to be initiated, or the baby can get his colostrum. When the mother is unconscious and being separated from the infant, again, hand expression should be done, and the baby should be getting milk as soon as possible. And then as soon as the mother is able to deal with the baby, the baby can be put to the breast. Now we should also create the most positive environment for this first breastfeeding to happen. And it helps, we've said that if the mother is more relaxed, more oxytocin has been secreted. So the more there's an atmosphere of tranquility, the better and the more positive this experience is for the mother, the more oxytocin will be secreted. So this is very important. And then obviously around childbirth, there are many cultural aspects that plays a role, and that should be taken into consideration. We know that it's very important to keep the baby warm after birth. So in order for him to, or for us to prevent thermal stress where the baby is cooling down, and as we've said, if a baby is cold, he uses a lot of glucose and oxygen in order for him to make him warm. So warm dry blankets should be used, and a hat can be used to cover the infant's head in order to prevent him from losing a lot of heat. If it's cold in the labor ward, which it hopefully is not, a radiant warmer can be used over the mother and the infant, so that both of them can have skin-to-skin contact. Some mothers can also, we can put a blanket over both of them, skin-to-skin, baby skin-to-skin on his mother, but then to put a blanket over her. And specifically where mothers have shaking chills, which they often have after the birth of the baby, and then they can't provide enough warmth to the baby, we can cover her with a blanket as well. Then family bonding is also very important, and the mother and the other parent and the support person can remain together for at least the next hour. But the most important thing is not so much the bonding between the baby and the other family, but more the bonding between the mother and the baby as such. And then we have talked about the first hour, that the baby is usually more alert, and that we should use and optimize at this stage before it's away, and it will usually recurs only after a few. Now, data confirm the view that delivery room or birthing center protocols that interrupt interaction and suckling between the mother and the infant increase the stress of patients and have a negative impact on long-term lactation success. And we have now seen all the different advantages of the first immediate breastfeeding and skin-to-skin contact. So my challenge is, how can you change your hospital policy, your personnel attitudes and daily challenges to accommodate this in the best positive way? Now there will be two videos that you can watch. The first one is on it's breastfeeding on the first hours after birth. It's a global health media video. It's a very good video. It tells you it's different babies. It shows you the process, how they go through different in the case of different babies. And they basically talk through the process. This second video is just the mother and the baby. There's very little, there's no comments, there's nobody that talk about. It's only the mother and the father of the baby that talk to each other, and the baby that's doing his breast crawl. And this is actually a very beautiful video to watch. Enjoy it. And that brings us to the end of lesson 2. I hope you have enjoyed it. I hope you're positive. I hope that you are, for those of you who are not doing it yet, is going to start implementing it as soon as possible. Also complete your quiz, and then you can continue to lesson 3.